At 9:45 here on Live Impact News, the demand for GLP weight loss drugs has skyrocketed, and so has the supply of knockoffs, apparently. Federal regulators just wrapping up a meeting weighing whether to expand access to compounded substances and peptides. To break this all down right now is Shabir Safdar, Executive Director of the Partnership for Safe Medicine. Shabir, thanks so much for joining us for this important conversation.
Thanks for having me. Public health is incredibly important.
Oh, absolutely. So for people just learning this term, what exactly is a compounded GLP, and how is that different from what doctors prescribe?
So your doctor probably wanted you to take a medicine that was FDA approved, and so they will go ahead and write a prescription for that. If you go to a telehealth company, though, quite often they're in the telehealth compounding industry business, where they make money off selling a lower quality version that is not approved by the FDA. They've mixed it from different chemicals, none of which come from Eli Lilly or Novo Nordisk, which makes the actual product, and they do it under conditions which are regulated at a lower safety level than what happens in an FDA-approved manufacturer's factory. Typically, they would do it because you have a unique allergy to something in the medicine, but that's not true with these weight loss drugs. People are just being pushed at them as if they were equivalent and being told they need a personalized version, but that's not what it is at all, and it's less safe.
Yeah, and so why has the demand for these peptides grown so fast?
Well, the weight loss injectables are one of the most revolutionary medicines we will see probably in this 25-year span. They work to do something we've all struggled with our whole life, which is to lose weight. They require a lot of medical supervision, though, and that's really one of the dangers we're seeing, is that these telehealth compounding websites are pushing these out with no medical supervision. You may not even talk to a doctor. You may have only an email or a chat conversation with a physician, and for the seriousness of these medications, that's not sufficient.
And poison control centers have received more calls about these types of products, right?
Yes, we've seen a huge, like 100% plus rise in calls about people who have misdosed themselves with the compounded versions because they don't have as clear and well-vetted instructions as the FDA-approved versions. And they're meant to be taken only as a last resort, but people are taking them up front. And, everything can happen from you accidentally triple overdosing yourself with triple the normal dose and you end up in the hospital with a very serious medical condition. We even had one patient who ended up from impurities in the compounding process lose her liver, and she had to get a liver transplant, which was tremendously scary and life-threatening.
Oh, wow. And we have to be fair, it has worked for a lot of people as well, these peptide compounds.
Compounded products can, but they're not approved for safety or efficacy by the FDA, and so the risk you take is unnecessary. Much like if I came to you and told you I have a cheaper car, but it doesn't have seatbelts or airbags. It might work for you for a while, but when you get in trouble, you're going to really wish you had bought the car that was actually safe.
Right, understood. Okay, so let's talk about what does a counterfeit or unsafe injectable look like, and how can we tell?
So there's 3 red flags that you should look out for. The first of which is if you buy a weight loss injectable from a website that's not a licensed pharmacy and it looks just like the real pens or pills that you would get from Eli Lilly or Novo Nordisk, you're likely to get a counterfeit. We've seen those since the beginning of the weight loss craze here with these medicines. The second condition would be if someone is offering you a compounded version and you don't have a medical reason to take it. You don't have an allergy that makes you allergic to the product. Let's say they say you need B6 or B12 vitamin with it. That's a warning sign that they are trying to get you to move to a cheaper, more profitable for them version of the product. And the last is we're seeing people actually buy weight loss injectable products from Chinese manufacturers directly. They're sold with the phrase "for research use only." That is another red flag. If you see that, that is not approved for human use under any condition and is also illegal to be sold and transited into the country. And it's happening a lot more than you would think. often in med spas, and you should run as fast as you can the other direction if you see something like that.
Okay, very good. I understand the FDA's Pharmacy Compounding Advisory Committee met just over a week ago. What are they considering, and what does this mean for the consumer on how these drugs could be regulated?
So the PCAC, as they call the acronym, it has an advisory capacity to recommend, and they were looking at 7 new peptides, not specifically GLP-1s, but for other benefits, health benefits. And they were considering adding them to be allowed to be compounded, which again would not be FDA approved for safety or efficacy. And the problem with those 7 compounds is that no one's ever tested on any number of humans. So we don't really know if they're safe or effective in humans. I mean, if they were proving them for compounding in rats, we'd be set. But they don't have safety or effectiveness data for humans. And so they did approve 6 of those 7. I testified against that, as did the FDA scientists. But the committee actually decided that they would like to use basically the American population as a large human trial to find out if they work and if they're safe. And I think it's a terrible step backward for patient safety in this country. But that was their recommendation. It'll still be years probably before those come out. And you'll see them on a longevity website. Right now, anyone selling things like the Wolverine stack, which is a popular peptide combination, is doing it illegally.
Ooh, okay. Yeah, I've never heard of Wolverine stack myself, but for someone who is considering using a GLP-1 or one of these peptide products, then outside of their doctor's office, any advice before one decides to try and buy it?
Well, never do it without medical supervision. Always get it from a licensed pharmacy. And ideally, if you're not going to your normal GP, look for a concierge medical practice that does really good wraparound care, because you need to be working with them on your diet, your exercise plan that goes with it, because you don't want to have muscle loss. And you need them to really screen you to make sure you don't have any risk factors. If that is true, you will experience life-changing weight loss. But if you just go to one of these telehealth compounding industry websites and you get an email screening from a doctor and that's all the medical attention you get, you're setting yourself up for a trip to the hospital at a future point.
All right, Shabir, anything else we need to know this morning?
Just really important that patients understand that the compounded medicines are versions of these weight loss injectables. They're not approved by the FDA for safety or effectiveness. You could lose both the money in your wallet and an important health event, trip to the hospital, and you don't want that. So just look for the FDA approved product. That's the most important thing.
All right, very good. Shabir Safdar from Partnership for Safe Medicines. Thanks for joining us here this morning for an important conversation, breaking all of that down.
Thanks for having me.
We'll be right back on Live Impact News.